Hi everyone, this is Himanshu. Today I discovered topic SGPT. First of all, another name of SGPT is ALT and ALAT. SGPT means serum glutamic pyruvic transaminase or ALT means alanine transaminase. ALAT means alanine aminotransferase. First of all, introduction. SGPT is an enzyme found primarily in the liver and kidney. Normally, a low level of SGPT exists in the enzyme. ALT means increased with liver damage and used to screen or monitor liver disease. Then, principal transaminase are the enzymes which promote the process of removal of alpha amino groups. Most of L amino acids to an keto acid. As a result, number of amino acids and keto acids are formed. Then reaction. L-alanine react with alpha ketoglutamate. Then product of this reaction is L-glutamate and L-pyruvate. Then further pyruvate connect with 2,4-DNPH in the presence of alkaline medium and convert to 2,4-dinitrophenyl hydrazone. This is brown colored complex checked by 500 micrometer filter. Then estimation of SGPT method, Redman and Franklin's method, requirement test tubes, serological graduate pipettes, measuring cylinder, water bath, stopwatch, photometer and centrifuge. And reagents is SGPT substrate DNPH reagent 0.4 normal NaOH sodium pyruvate standard 22 microgram per dl. Stability of reagents is stability 1, 2 and 4 are stable at 2 to 8 degrees Celsius. It means cool temperature. Reagent 3 is stable in polyethylene container for several months at room temperature. Sampling serum, fresh serum used to be interfered with the test. Thank you.